very nice to be here in Paris today. These are my disclosures. So there are many ways to tighten the skin. You can use ablative laser resurfacing, radiofrequency, non-ablative lasers, picosecond lasers now, also microfocus ultrasound, and other ways to lift the skin would be suspension sutures, and we'll talk about a few of these. So there's many different technologies that are out there, and they all basically attempt to do the same thing. So that's tighten skin laxity by the deposition of heat. So one of the things to consider when choosing which device to use is the patient's lifestyle, how much downtime they can afford, and how much time off they can take. So for patient selection, patients with less laxity tend to do the best. Elderly patients that have significant sagging are not great candidates for these devices. However, if they don't want surgery or if they're poor surgical candidates, then it's still an option. So patient counseling is key. It's important to set realistic expectations off the bat. I always stress that these results are really unpredictable. I can't tell who's going to get a very dramatic result and who's going to get a more subtle result. So it's important that they understand that. Also, it's important to stress that these procedures are not equivalent to surgery, so this is not like a facelift or a neck lift. So most patients only see a mild to moderate improvement, and it does take some time to see the results. Oftentimes it takes up to 3 to 6 months, so if they're trying to have the procedure right before a wedding or something like that, then that's not enough time. So the mechanism of action is controlled instantaneous heating. So it's precise heating of the collagen, which leads to destruction of the hydrogen bonds, and that correlates clinically to immediate tightening. However, the true results do take several months, like I mentioned, and that's from new collagen deposition and fibroblast proliferation, which does take some time. So radiofrequency, for the most part, they're safe for all skin types, and again, mild to moderate laxity does best. So the main contraindication would be patients with pacemakers. So monopolar radiofrequency, or thermage, was the first device for non-invasive tightening. The nice thing about it is there's no patient recovery time, and the treatment protocol has changed over time to decrease the side effects. So we now use lower energies and deliver multiple passes. I don't use any pain control with these procedures because I want that feedback, and so I want them to tell me if it's too painful, because then I adjust the settings depending on their pain tolerance. So this is a reasonable result from Dr. Kilmer after just one treatment. So let's focus on some new advances. So similar to the thermage, this is the Introgen. It's a monopolar radiofrequency device. However, it delivers fractional radiofrequency. So you have fractional heating through the epidermis, and this creates a more uniform thermal zone in the dermis. It's also a more comfortable treatment, and you can see you get nice neocollagenesis and new elastin formation. So subsurface monopolar radiofrequency, or this is the TherMe. So this is a little bit more invasive, minimally invasive. It uses a subdermal probe that goes underneath the skin and deposits heat right at the target tissue. It does require tumescent anesthesia, and there is a lot more downtime with this. You can also get some temporary nerve palsy, so it's important to stay away from the danger zones. So this is the thermal probe that goes underneath the skin, and there's a temperature sensor that tells you the temperature right at the area that you're treating, and then there's also an infrared camera that you use to measure the surface skin temperature. It does take some time to do these treatments, so each section takes about 15 minutes. You need to heat each area to your target temperature, and then you move a centimeter at a time until you get the entire area to that target temperature. So it does take some time. There is some downtime associated with it, but you get some nice dramatic results with this procedure, and this is Dr. Fitzpatrick's result. This is probably my favorite newest advance in skin tightening is fractional needle radiofrequency, which is basically like microneedling with heat. So not only do you get skin tightening, but you also see improvement in texture, which is nice. It's also good for scarring, and some devices also improve telangiectasia and lentiginase. So the mechanism of action is similar to fractional lasers. So basically, the microneedles create thermal wounds in a fractional pattern to stimulate dermal remodeling, and then the intervening areas are ineffective, and that serves as a reservoir to promote healing and decrease downtime. So like I said, I kind of treat these like fractional ablative lasers. So I do use prophylactic antibiotics and antivirals. And then they can be somewhat painful depending on the settings that you choose. So I personally use a topical anesthetic in addition to nerve blocks, and then locally injected anesthesia. And I love these mesoram needles, which are multi-injector needles that allow for efficient local injection. So this particular device is the Bipolar Needle RF, so this is the Fractora. So the depth is determined by the length of the needles, and then the density of your treatment is determined by the number of needles. So this comes in a 24-pin, which has 3 millimeter depth, and then a 60-pin tip, which goes 600 microns, and then there's also the option of using a coated tip for darker skin types. So this is the coated tip, and so it's silicone coated proximally, and then it's non-coated in the distal 300 microns, so it's only delivering the heat into the dermis while protecting the epidermis. So if you look at the ablation, so this is the 60-pin tip, so it's only going 600 microns. In the center, this is the 24-pin going 3 millimeters, and then this is the coated tip, so you can see the epidermis is preserved. And so this is what they look like immediately post-operatively. So just some pinpoint bleeding, which resolves almost immediately, and then a little bit of erythema, so not that much downtime. And then this is 1 year after 2 treatments. So the next device is a high-intensity focused monopolar RF, so this is the Infini. So the main difference between the previous device is that all of these needles are coated, so again, only delivering heat in the distal 300 microns. So it is safe for all skin types, no epidermal injury and very little downtime. And again, you can adjust the depth of the needles. And with all of these devices, you want to do multiple passes at different depths, and this is kind of the multi-layer approach to target different problems like scarring or tightening. And so you can see here, you can go 0.5 millimeter, 1 millimeter, up to 3.5 millimeters. So this is one treatment 2 months after just one treatment. And then this is the Intracell, which combines both monopolar and bipolar needle RF. So the monopolar is more diffuse heating versus the bipolar is more localized heating. And again, combining these two technologies potentially can give you improvement in efficacy. So all of these needles are coated, and the number of needles stays constant, but you can change the depth of your treatment. So this is immediately after, and then you can see there's really not that much bleeding, and then 3 days later, not much downtime. So they heal pretty quickly. So in my experience, these devices approach results seen with fractional ablative lasers. However, the downtime is much easier and the procedure is better tolerated. I find that it's more consistent tightening than some of the other devices, but comparison studies are definitely warranted. So picosecond lasers now are a new way to tighten the skin using a diffractive array, or diffractive lens array. And so this distributes the laser energy into low and high intensities. And then the high intensity energy is absorbed by the melanin. And this leads to laser-induced optical breakdown. So the pressure waves disrupt the cells, and it triggers dermal remodeling and increases collagen and elastin with very little downtime. So you can see that 24 hours post, it's really doesn't look like there's much healing. So these are the laser-induced optical breakdown right here. So you can see there's focal injury, and this leads to increase in collagen and elastin. And so studies have evaluated fractional picosecond lasers for tightening of the neck, and you can see you can get some nice improvement with very little downtime. So why can't we do better with tissue tightening technologies? The limits of tissue tightening are evident. Clearly, we need a new way to think of this in order to produce more effective technologies. So perhaps achieving tightening is not the correct strategy. We know that natural skin tension with aging is due to a loss of elasticity, so maybe restoring elasticity may be a better goal, but many of these treatments don't really focus on elasticity. They're more increasing the collagen, so there's very little data on restoring elasticity. So another way to tighten loose skin is just by lifting. So this is another one of my favorite procedures, suspension sutures. So it uses a bidirectional cone to provide an anchoring point in the subcutaneous tissue, and it physically just lifts the skin. It's made from resorbable sutures, polyglycolide, L-lactide, so it's a copolymer. And it just mechanically fixes the tissue and also stimulates collagen to encapsulate the suture. So as the suture is dissolving, it's stimulating collagen, very similar to Sculptra. And so the results actually improve with time. So they are resorbable, and you see the results immediately. And then, like I said, with this biostimulatory effect, you actually get more improvement with time. And there's very minimal recovery. So this is immediately after, and then at about a year out, they actually look even better. So just to conclude, tissue tightening can non-invasively provide improvement of skin laxity in a safe manner. Results are unpredictable, and they do not approach the results of a facelift. So it's important to educate patients as to the limits of these devices prior to treatment. But I think if they have realistic expectations, then the minimal improvement that they get for very little downtime, I think they're very happy with. And that's the end.